If you ask 10 people how much Medicare actually costs, the majority of them would tell you it's free. And that's the biggest misconception with people getting onto Medicare. It's not actually free, and it can end up being the biggest line item in your retirement budget. So if you're getting ready to retire and you're trying to budget out what Medicare looks like as a total cost, I'm going to go over in the next 9 minutes what the 2026 premiums look like for you, deductibles, co-pays, everything that you need to know about a Medicare budget. Hi, I'm Joseph Pate, better known as Medicare Joe, and we've helped thousands enroll into Medicare successfully, planning a successful budget around what Medicare will cost them. And here's the pain point I really want to set in for everybody today. Medicare is not free. It's not even close to free, and people who plan around like it is end up funding most of it out of their retirement income later in life. So let's actually look at the bill and understand what Medicare will cost you in 2026. Here's what I see every week. Someone's 6 months out from turning 65. They're excited. They finally hit that finish line, getting onto Medicare and getting ready to retire. And they tell me we got Medicare coming up, so our health care in retirement is completely handled. And I have to do the part of the job that I don't love the most, which is telling them that, hey, Medicare actually is not going to be free. In fact, it's going to be one of the largest line items in your retirement budget, and you need to prepare for it. The only question is, do you know that prior to going into Medicare? Or is that going to be a surprise to you once you get started with Medicare and seeing all the costs? So let's make sure, if you're watching this video, that it doesn't surprise you when you get onto Medicare. Because here's the crazy part about Medicare. You can have two people with the exact same Medicare in the exact same town on the exact same plan, and they can pay completely different amounts. Not because, again, they have different plans, it's the exact same plan, but because they have different income. And the difference in income surcharges can be hundreds of dollars a month per person. So that alone catches a lot of people off guard. But it's not even the biggest hidden cost when it comes to Medicare and what this all can look like for you. The biggest one is what actually isn't covered by your plan and what nobody tells you about. So stay with me here, because by the end of this video, I'm going to go over all the actual numbers that you need to know to plan ahead so that doesn't happen to you. So let's go through it here. The official 2026 numbers from CMS, which is the Center for Medicare and Medicaid Services. So Part A, we'll start there. Most people actually pay zero for this part. So that's the biggest misconception. People think Medicare is free. It's just Part A. So your Part A is free to you as long as you've worked at least 40 quarters in your lifetime, or your spouse has. That's going to be free to you through your payroll taxes. You paid into that all those years. And if you go to the hospital, for example, there is a deductible with Part A. It's $1,736 per benefit period. Not per year, per benefit period. So each time you're hospitalized, that's a deductible. Now that cost can get covered in its entirety by a Medicare Supplement, which you pay a premium for every month to cover that. I'm going to get into that in just a little bit here. But Medicare Part A is free in a premium cost. It does have a deductible associated with it every time you go to the hospital. Part B. Now this is the one that everyone has to pay per month. This is the one that gets a lot of people caught off guard by surprise. This comes out of your Social Security check once you start receiving Social Security. If you're not receiving Social Security and you're starting Medicare, you actually pay into it. So in 2026, the standard Part B premium is $202.90 per month. That's a monthly premium that you pay for Part B. Part B has a deductible of $283 for the year. So after you hit that deductible, now Medicare is going to kick in, and they're going to cover 80% of your medical bills. So there is a 20% gap, and that's again where the Medicare Supplement plan kicks in. Part D is a cost on Medicare. So Part D premiums, they can vary quite a bit when you are looking at the plans based on drug use. The good news is with Part D is the out-of-pocket maximum for the year. So if you took all of the co-pays, you'd hit $2,100 for the year. So that would be your cap if you had all of your medications, co-pays, they equal up to $2,100 out of pocket for the year. You no longer pay for medications. Everything is covered at that point. The premium again per month ranges from zero, if you're not taking a lot of medications, all the way up to $120 a month. So as you can see, this is adding up, right? I mean, we're already a lot more than free, which a lot of people think Medicare is. Now, the last one here I want to talk on is IRMAA. So this is the income surcharge. So this is the one that really catches a lot of high earners. So if your modified adjusted gross income is over 109,000 if you're filing as an individual, or 218 filing as a coupling, and that's all income, that's withdrawals from retirement accounts as well, you pay an income surcharge on top of Part B and Part D premium. But your total Part B premium at that point, if you're above those two thresholds at a bare minimum, it can go from that 202.90 and it can get as high as an extra $690 a month for just the Part B premium. And that can include a one-time spike in the income. You sell a house, you do a Roth conversion, you take a big distribution from the retirement account to put that pool in that you wanted to put in the backyard, whatever it is. So now you have the real premiums and deductibles of what Medicare can actually cost you per month and a little bit with it on the plan. But the second part that really nobody tells you about is the premium isn't the most expensive part about Medicare. The expensive part about Medicare is everything that Medicare doesn't actually pay for. And that's the part where you, as the consumer, start to make decisions on how you want your healthcare to work over the next 5, 10, 15, 20 years. Let me show you really quick what that picture can look like for you getting onto Medicare. So when you're thinking about actually budgeting for Medicare in 2026 here, there's three things. We need to plan for the Part B plus something on top of that, not just Part B alone. So what I mean by that is if we're on Part B with Medicare, we have that 202.90 premium. I said this earlier. That's just the starting line. That's the foundation of our plan. You would then add a Medicare Supplement plan to that, which is going to be about $100 to $150 a month. So you get 202.90 plus $100 to $150 a month. And then you're going to have a Part D drug plan. So your Part D drug plan, let's just budget for about $15 a month just to keep the numbers easy. That's really what you're looking at a total monthly cost for you to be insured with original Medicare and a supplement plan. Or we go the route of Medicare Advantage, and that's where it bundles it all together. In this path, you just would have the 202.90 premium, but then you're gonna have co-pays that you're paying on the plan as you use it. So again, it's important to know that Part B is not just the premium by itself. You need to understand there's two roads here and there's a lot more that gets added to it. But the other piece I would like to make mention of is if you didn't have something on top. So let's say you're looking at this and you're saying, well, I'm just gonna have Part A and Part B. Well, you can do that, but you're gonna be exposed to the hospital deductible every time you go in. And then you're going to be exposed to 20% coinsurance that the Part B doesn't pay for. So Medicare Part B covers 80, you cover 20. The problem with that 20% and why everybody does add a supplement plan is there's no cap. So that's why a lot of people add the supplement plan instead of rolling the dice, because you don't know how high that bill could get because it's a percentage, it's not a flat copay. And again, the last piece here, if you're a high income earner, and I urge you to watch the video, I'll link it below here again, about retirement planning and that whole side of things, because IRMAA looks at your income from 2 years ago. So the decisions you make in your early 60s, if you're talking to someone about Roth conversions, again, real estate sales, large distributions, that will count as a higher income for you in that calendar year, which means you're going to pay a higher premium for the new calendar year that we're in at that point when you're on Medicare. And most people don't find that out until they get the letter in the mail that says your premium for 2026 is going to be $690 per month because of an income increase. And here's the honest part at the end of the day. I mean, Medicare doesn't have to be expensive if you plan for it. It becomes expensive because happiness is a function of expectation, right? If we know what the real numbers are going to be, and then you discover them line by line, you know, in a plan versus getting a bill that's explaining it to you line by line, that's a real different perspective. And the best part is you can prevent that, and prevention costs you nothing through planning. So if you or you know anybody that is getting onto Medicare or about to retire, share this video with them. Most people walk through this with the wrong idea that Medicare is going to be free to them. They're getting to the finish line. It's all going to be taken care of. And that's not the actual scenario of what happens. But if you are getting onto Medicare, my team's happy to walk you through a free consultation. We can budget out what Medicare actually will cost you. You can book that with the link below as well. Speak with one of our team members. If you like this video, give us a thumbs up. If you'd like to be notified when we post new YouTube videos to the channel here, hit the subscribe button. And again, I'm Medicare Joe. Thanks for watching.